Hello, everyone, and welcome to our webinar hosted by the American Public Human Services Association in collaboration with the Change and Innovation Agency. Today's webinar is called Don't Let Public Health Emergency Unwinding Be Your Agency's Undoing, ensuring all your bases are covered. My name is Christine Johnson, and I am the Assistant Director of Policy at APHSA. Next slide. I'd like to provide you with just a very quick overview of what we do for and with our members at APHSA. The American Public Human Services Association, or APHSA, represents state and local human services members from across the country. Next slide. We aim to deliver to our members on three core channels: influencing modern policies and practices with the goal of strengthening communities, building capacity through conferences, technical assistance, publications, and organizational effectiveness consulting, and connecting members through a wide circle of stakeholders and partners in the human services sector. Next slide. You'll see here we have several conferences throughout the year, starting with our National Human Services Summit in Baltimore, May 21st to the 24th, followed by our Economic Mobility and Wellbeing Conference in Long Beach, California, August 27th to the 30th. And in September, the 10th to the 13th, we have our Information Technology and Solutions Management Conference combined with our annual Attorneys Education Conference being held in Kissimmee, Florida. And lastly, we have in October our Staff and Development Training, October 22nd to the 25th. Please check our APHSA website for additional information. I also want to let you know that we are doing, APHSA is doing 2 peer exchange calls on March 21st at 2 p.m. Eastern Time and March 29th at 3 p.m. And I will put that information in so that you have it in our webinar today and in the event that you would like to join us. And now it is my pleasure to introduce you to Blake Shaw from CIA.
Good afternoon or morning, everybody. I'm Blake Shaw, President of the Change and Innovation Agency, a firm dedicated to increasing human service agencies' capacity to do more good. Next slide, please. We've had the great honor of working with many of you through the years, and today what we wanted to do is truly highlight what some of the work and the preparations and the execution that your colleagues have been doing to prepare for the unwinding of the public health emergency, which is going to be a very significant event in our history. As I was thinking about this, many of you, you've managed through the Great Recession, through ACA, through the pandemic. So in a sense, you've done the warm-ups, and everyone we thought was game time, but now we're on for true game time in this significant event. But the main point is how do we make sure the folks that we're serving are renewed with their Medicaid renewals? How do we maintain their service or at least bridge them somewhere else? So twofold purpose today. One is to hear how your colleagues from Missouri and Connecticut have been doing things in the Center on Budget and Policy Priorities. We all know there's guidance and CMS and plans, but then there's the thousands of details that it takes behind the scenes to pull this off. And second, to be useful. I wanted to create an avenue for you. So as you hear things that your peers talk about today and you want to double click on those, when we send out this slide deck next week, we'll provide more information, but also the contact information of the panelists in case you need to learn more. Next slide, please. Our agenda today, we're going to set up the situation, and then we're going to talk about having bases covered in 5 or 6 areas. And that's where I'm going to be the moderator asking the panelists questions, and then we'll summarize. Next slide. So next slide. I don't have to tell you, but I will tell you, 84 plus million Medicaid renewals are going to need to be processed after March 31st over the next 12 months. This is nothing new to you, except the thing that we see from our standpoint, as we get to talk to many states, are the difficult pieces in place and barriers that you're facing that are unprecedented. So we have agencies that we've talked to that are facing a 50% vacancy rate. It's a difficult hiring market. Post-pandemic, and virtual, quasi-virtual, back in the office, it's just been an interesting market, which has created huge demands and challenges for HR. And how do we hire? How do we utilize staff? Unskilled workforce, not that you don't spend great time and put great effort in training them, but what I mean by that is if we have up to 50% vacancy rates, I'm predicting mid-year this year, we're going to have close to 50% of our staff that have less than a year of training and experience. So that creates a difficulty in how you're managing the work. Technology constraints, and then the reporting pieces that will help maintain and increase FMAP. So next slide, please. So capacity is going to be the key to pain management. We are defining capacity as the ability to do more with the resources that you're given. There's a finite level of resources, and we understand that in state government and county government. And so how do we find that? Next slide. And so we're going to hit on finding capacity in the following areas today: communications, people, process, technology and systems, data, policy, and budget. And with that, I'm going to introduce our panel and jump right in and get to the good stuff. Next slide. We are fortunate enough today to have the states of Connecticut and Missouri, and then the Center on Budget and Policy Priority join us. These are folks that have been in the trenches. And so I'm just going to say their names, and then they will choose to speak more, or what they're going to tell you will tell you enough about them. They're all remarkable leaders. Yecenia Acosta is the Associate Director of Field Operations for the Connecticut Department of Social Services. Sharon Condel is Director of Business Systems, also in Connecticut. And Laurie Wagner is the Director of Planning and Improvement Office in Connecticut. Melissa Wolf from Missouri is the Deputy Director of their Family Support Division. And then Jennifer Wagner is the Director of Medicaid Eligibility and Enrollment for the Center on Budget and Policy Priority. And I first got to meet Jennifer when she was one of you. She was administrator over field operations in the state of Illinois. So she's been in the chair, been in the shoes before doing that. A couple of stories that I've learned as we've been preparing for this are just, I think, remarkable. You'll hear today on Connecticut's kind of full person approach to the unwinding of the public health emergency. Everything from how do we renew our folks to, if they are found to be ineligible, how do we bridge them over to the healthcare exchange and make sure that they have a chance to not be without, which is a really full perspective, I think, that they've taken. In Missouri, besides some of their data insights and tech work they've done, is they realized that their people were their biggest capacity. And they had to get rid of backlog. And so you'll hear stories from Missouri where a matter of months ago, they had Magi Medicaid apps about 100 days old. And as of last week, Melissa told us there's not a Magi Medicaid application over 2 days old in the state, which means all those people that were working on old cases are ready for the renewals coming up. So I'm gonna get out of the way though, because Jennifer also is she consults nationwide with Medicaid agencies. So she's gonna shed a broader perspective on everything our panelists say. So with that, let's move on into the questions. Thank you all for being here. Next slide, please. Okay, so first of all, let's talk about customer communication. And the question is, how have you been communicating with customers so that they know what's on the line, what they have to do to maintain coverage? And to start this off, we're going to go with Melissa from Missouri.
Good afternoon or morning, wherever you may be. Thank you, Blake. So Missouri has kind of attacked this in a couple of different ways. We have started with social media posts to say, here's what's coming, here's what you can expect, this is what it means for you. We've also updated our website. We have regular stakeholder and provider meetings with not only like with our hospitals and clinics and our managed care. We try to talk to as many people as who will listen, actually, and we have a very large active Medicaid advisory or stakeholder group in Missouri, and we meet with them at least once a month and sometimes more, depending on what's kind of bubbling. So we've had regular meetings with them to keep everyone on the same page. We've also created a special flyer to show what the unwinding process will look like in Missouri. And it's very specific to how we will be doing annual renewals and what customers can expect and when to expect information from the state. So
That's
that's
great.
a high overview that we've done for our customers.
Okay, that's great. I especially like the timeline idea. Let's move on to Laurie Ann in Connecticut. What have you guys done to prepare and to communicate properly on the front end?
Well, hello, everybody. The first thing that I would want to just share is, Blake, you had made the mention that Connecticut has tried to approach this very holistically and looking across all of our systems. And I just want to mention that our communications is coordinated by one of 5 work streams that we have developed for PHE unwinding efforts. We started this about a year ago, and we coordinated or organized it into 5 work streams. Communications is one of those. And how we have approached communications is we've looked at our 3 primary audiences. One is our clients. The second is our partners, those that are our professional stakeholders that work with us. And the third is the staff within the agency. One of the first things that we did is we did an Update Us So We Can Update You campaign. And this was outreach encouraging benefit recipients to update their contact information to ensure timely receipt of notices. And we've done that. We contracted with an external vendor to assist us with media purchasing. And we have bus wraps, we have bus shelters, we have billboards, very targeted media in the communities we know that we want to reach. With newspapers and radio ads. We also have social media message campaigns, also encouraging people to update their contact information. We've created a website that has 2 platforms, a toolkit for partners and a toolkit for clients. Those toolkits include FAQs and resources. They also each have a video for partners and clients about changes. The one that's up right now is around the emergency allotments from SNAP ending. And we also have a toolkit for our workers, our eligibility staff. And then lastly, we have notices to our impacted clients. And we are doing that in a lot of different ways. We have mailings being sent to the households. We also have text messaging that is starting to go out. We use that for our SNAP recipients to alert them to the emergency allotments ending. And then finally, we are doing presentations and bulletins to our external stakeholders, most notably our governing bodies, our legislature and our governor's office, state agencies, most notably those health and human service agencies, community-based organizations, those we partner with and who assist us with our clients, and those who have overlap with our clients, and providers. And we are doing weekly bulletins with them that is just starting. And we are also doing, like I said, those outreach presentations.
Very comprehensive. Thank you, Laurie Ann. Now, Jennifer, what are you seeing nationwide in your work with Medicaid agencies?
Well, as you saw from these 2 examples that you've heard from, the work is truly impressive. It's unprecedented and it's really creative, the way that states are trying to reach clients now. Some of it is a little bit old school now, like texting, but it's taken us so long to get here. We've got the FCC guidance right now. We've got that requirement on returned mail that is pushing states forward. But that's just a huge step in the right direction in communicating with clients in a more effective way and really reaching them where they are. Nationwide, we've seen really great progress on this update your contact information message. That's been wonderful, and I think it's driven a lot of people to websites. It's been great where it also includes create an online account, where it situates people to be better prepared for the renewal when it comes due, and really creative messaging in this context. One thing we haven't seen as much of, and obviously that's going to ramp up over the next few months, is step 2 of messaging. So update your contact information is step 1, but now we're actually into the renewals and instructing people on how to renew. It's a complicated message. You don't know when your renewal is due. So saying open your mail for the next year is kind of tricky, but we've got to really figure out a way to kind of keep up the momentum and make sure we're addressing that critical area. And stakeholders are really the key partner in all of this. As much as you do at the state level, there's certain pockets in the community where, it's going to be hard to reach. And so those partners on the ground who have cultural language competency and can reach some of these harder to reach communities are going to be essential to both get the message out on what is coming and what needs to be done, but also that other aspect of communication, hearing back from folks on the ground about what's working and what's not working.
That's a good reminder, Jennifer. It's now you've done phase one, great work, but don't forget, right? So thank you for that. Next slide, please. So the next area I want to dive into is people and process. And so I want you to consider these three questions as you're providing your answers. One, how are you staffing to prepare for APHSA Unwinding? It's been fascinating nationwide on the mixture of state and county staff versus how we're using contractors, the hybrid approach. So I'm just curious on that. Second, how are you organizing your workflow to succeed? So for example, are you treating it any differently than you would pre-pandemic? Because again, some of your workers, and a great percentage, might have never done a Medicaid renewal, right, at this point. And then the last one that I'm always curious about is, has backlog been a factor in your planning? And if so, how have you addressed it? So first, we're going to go to Connecticut this time, to Yecenia.
Hello, everyone. So I'm just going to touch base on a couple of things that Blake mentioned here. Just for a quick history, on July 1st of 2022, Connecticut was hit with what we call the silver tsunami. Our agency had approximately 250 staff members retire. So that caused a trickle-down effect to our field operations, because our field staff are the entry-level positions, and from there they can go on and apply for promotions or positions elsewhere. So as the retirements occurred, our staff was being promoted, which was great for them, but it kind of hurt us in the end. So a decision was made that we were no longer going to have our offices focusing on particular work. So before, we had offices who were assigned strictly to our benefit center, strictly to processing, and all 12 offices did service center. We decided that it was important our staff become agile. So we've created this model called the Agile Workforce. All our staff members currently are trained in all our programs. They have the ability to assist on our phones. They have the ability to process the work, and they have the ability to assist in our service centers with the walk-ins. We thought this was very important because we did not want staff to be pigeonholed in one subject matter. And then as time went on, we also made a decision to include our third-party vendor Condel. We added a couple more things to their contract, and now they are part of what we call it First Touch. So now when a client calls our benefit center and they have basic questions or they need forms, so on and so forth, our First Touch staff with Condel and some of our newer employees answer those basic questions. If the call gets to a point where they cannot answer it, then the call will get transferred to our subject matter experts, which are our seasoned staff. So that seems to be working, and we get good feedback with that. We did have a massive hiring because we have to fill all those vacancies. So between October and December of last year, we did hire 118 new staff members. And currently we are in another massive recruitment effort. So if everything aligns correctly, by July 1st of this year, we will have approximately 230 staff members with under 1 year. All staff members who get hired or have been hired since October do follow this First Touch process. They go to training for 2 weeks, come back, they get on the phones for a bit, and then they go to training for all the other programs. We find this has been helping because it allows us to answer calls quicker. It allows us to provide good customer service. And then it also allows our leadership team and our managers to organize our workflow better. And we can prioritize our needs. I'm sorry.
No,
in terms of the backlog, we do keep that in mind. So this is why the agile workforce was very important to us, because timeliness is our first priority, and we want to ensure that we're getting to everything we can timely and effectively, and to ensure that our clients are being served properly.
Thank you. Thank
You're
you
welcome.
very much. I love the agile workforce and everything like that. I think it's got some real legs for you guys. Can I ask, so if you're going to have over 200 new staff with less than 1 year, is that about 20-25% of your field staff, or what percentage of your field staff is that?
Yeah, it's about that.
Yeah.
Yes.
Okay.
Mhm.
So the struggle is real, right? And you
Mhm.
guys are figuring out how to creatively deal with that. So,
Right.
okay, thank you. Let's go on
Thank
over
you.
to Missouri. Melissa, what have you guys been doing in terms of people and process?
Thank you, Blake. Missouri has taken a very similar approach to Connecticut, and ensuring that all staff can work all cases in different manners and not have silos, so that we can have a more agile workforce. So we took during the pandemic, we took that opportunity to kind of cross-train and really get our staff out of silos. We also, the workflow, which then leads to, you get what's right there ready for you to do that can be done, whether it's a call or someone walking in. So we work right there with the individual, try to do first touch resolution, finishing the case, so the participant doesn't have to come back or call back for answers, to get resolution, so they can walk out or hang up or however, and know the answer to their question and know where they stand with their case. We have done several town halls with our executive leadership, with all of our staff across the state, kind of really just to keep everyone informed of, this is what's coming, this is what it means to have the end of the PHE and continuous eligibility, this is what it means, this is how it will affect your work, this is what will change, what won't change. We've also come up with some retraining for how to complete an annual renewal. Missouri did not continue to do annual renewals throughout the pandemic, so we have staff who haven't done one in almost 3 years, and we also have staff that have never completed an annual renewal because we've had high turnover also. We did fluctuate around the 20% vacancy rate for quite some time, and so that's a whole new learning that part of our staff have to do, is really to understand how to complete an annual renewal. We have done some enhanced hiring practices also because of the turnover we've seen in the last 2 years specifically. We've also communicated often with our staff about what each change means, and just we found those town halls and those basic calls with frontline staff being able to talk to director has really been very helpful. They hear it straight from the director's mouth, but they also are able to ask questions on those town halls. They've been very beneficial. In regards to backlog, Missouri, as Blake alluded to earlier, Missouri did have a pretty significant backlog up until just recently, and we even started attacking it at the end of last year, because we knew we had to be ready for annual renewals whenever they came, and we couldn't start behind knowing we wouldn't be able to keep up with what was on the horizon, even if we didn't have a certain date. And that's where that cross-training and allowing staff to work on multiple cases and not be siloed, or multiple benefits and not be siloed, really helped us attack that backlog. We did do some overtime when addressing that backlog too. We found staff really do lean into overtime when it's voluntary and not every day. So that's kind of how we attacked it when it came to people and getting out of a backlog, and just communicating with them often and being honest about where we were, like where are we in the process.
Yeah, and that's so key. It sounds like both of you states, are also maintaining visibility, right? If we know where we're at any given day and how our staff are doing, we can communicate that, because let's face it, our staff come to this job to make a difference. And so the more that they get that impact of the difference they're making, I just think it's great. It creates loyalty. So Jen, what are you seeing nationwide in your consulting work with the Medicaid agencies?
Well, staffing shortages are nothing new. Many of us were around during the Great Recession, ACA implementation, and some of these challenges. But this does really feel to be at an unprecedented level, considering the demand that is coming the way of the states. There's been a lot of attention to vacancy rates, which is understandable with a hiring environment right now. But what always strikes me is vacancy is underneath your allocation. And in so many states, that allocated staffing level is desperately below what you really need in light of the demands and the caseloads you have. So I just find that striking. It's great that there's the 75% federal match for Medicaid eligibility workers. I just want to kind of remind states that that's out there. I know that doesn't always translate when you get to the legislature and the budget office and all of that, but there is federal support for that once you can hire and train them, of course. So, as you saw with these states, some states are utilizing contractors to supplement their own workforce. And that's understandable, but we worry about some challenges with SNAP and with kind of handoffs. Some integrated states are using contractors for Magi only cases, which is, appropriate, but sometimes it could lead people to apply for Medicaid only and not joint programs. And there's also some concerns about like handoffs as far as this, tier 1 and tier 2 and what can each person do. Historically, we've seen that sometimes be challenging for clients to navigate. So that's just another area that states are going to be watching and looking for feedback on. But other than that, there's been a lot of attention to utilizing partners. Managed care organizations are playing an unprecedented role in doing outreach to clients, doing some follow-up, as well as other navigators and assisters and folks on the ground. I think the key for states is just to make sure that their path is as smooth as possible to help people. It's great if you're having the managed care organization send a text saying your renewal is due, but if somebody calls their call center, how can you actually help them do the renewal? How can those folks out in the field do as much of the process as possible so that your workers get a complete form that's timely and that it lowers the burden for you? So I think lots of opportunities for collaboration on that front.
Okay, thank you, Jen, very much. One thing that I failed to mention, folks, and next slide as we're talking is there is a Q&A panel that we're monitoring. Some answers are going out and some of them are meant to, if you have specific questions, we'll ask the panelists to address those at the end, but please don't hesitate to pour on your questions and we'll keep these into account when we follow up as well. The next one, there's two really, really meaty sections in this webinar. One was the people process. The other is the technology, because there's been a lot of attention on that in the preparation and the very innovative things that have been happening. So I just want to hear from the agencies and from CBBP on what they've been seeing and doing with regards to how you're utilizing technology or creating new technology to do this. And we're going to start this one with Sharon from Connecticut.
Hi, good afternoon, everybody, or good morning, depending on where you are. So in Connecticut, we made a decision very early on at the beginning of the PHE that we were going to try and continue doing our renewals as much as possible. So we continued with the process of renewals throughout the entire pandemic. And if we got to the point where it was going to lose eligibility, we took every effort to keep them enrolled so that they had their continuous eligibility. So we started focusing on what we could do in order to keep those folks eligible as we started the unwinding. So we made a decision to stagger the renewals over a 12-month period, starting with our oldest group of folks first. And when I say oldest, I mean the oldest renewals that were outstanding that had not been completed since the start of the PHE. We looked at our percentage pass rates and what they were, and they were very low initially, 20%, because folks hadn't been on. We didn't have a lot of good information. So we started looking at our reasonable compatibility rules to see what we could do to adjust those rules in our system. And to also, let me step back a little bit. So we have our health insurance exchange and we have our integrated eligibility system. And within our health insurance exchange, we have our Magi Medicaid groups, and it also has eligibility for the QHP, APT, and APTC groups. So And then if somebody becomes ineligible in any of those groups, they then come over to the impact side of the house and we determine eligibility in the non-Magi group. So our systems are joined together in a way that we try and keep people as covered as possible. We also came up with covered CT in Connecticut as well to try and expand coverage for our groups. Right now, we're taking advantage of about 4 of the E14 waivers. We're in the process of trying to make sure that we can take advantage of that as much as possible. We are instituting the interface with the national change of address. And we're also looking at putting Equifax at the top of our hierarchy for income eligibility because it's the most real-time income eligibility, so that when we're running our passive renewals, we do a lot of passive renewals here in Connecticut. Our passive renewal rates, depending on what your program is, can be anywhere from 50 to 60%. We're finding that with the older groups of renewals that are outstanding, that's bringing our percentage of passive renewal rates down some, but we do anticipate as we go through this process that we're going to see our rates increase. We also, during the pandemic, started using RPA with our online renewals only. So we don't have a large volume of online renewals coming into Impact. We use the RPA in our Impact integrated eligibility system. But those are also, they're a helper. They don't completely process the eligibility all the way through, but they do run all of the interfaces. They do all the checks. They put the narrative. So when the worker comes in, all I have to do is look and say, yes, that looks right, and process the case. So we do anticipate that the usage of the RPA will go up once we start doing more renewals. So we've made a lot of efforts to make sure that our rules were aligned right, that we are taking as much advantage of as we can of the waivers. It's been kind of challenging, but it's been a really good effort working together with everybody to have it happen.
Yeah, well, thank you, Sharon. We've seen, I have a report somewhere that had you all in that 50 to 75%, on passive, and there's only one more box, and it sounds like you're heading there. So the 75+%. But also your RPA comment is really fascinating, because we've seen some states just doing some really impactful things, or at least planning those things with how are they able to create capacity, that way through RPA, and allow the worker to do what the workers are trained to do. So thank you for sharing. Melissa, Missouri, how about your all's technology innovations?
So we have a couple of big technology that we're that we're really pursuing and should be up and running in the next couple of months. One thing I do want to say is, unlike Connecticut, we didn't do our annual renewals throughout the pandemic. So when we were working with CMS, we chose a plan that was simple and modeled in a way that we would open our system, quote unquote system, to just pick up where we left off. So if your annual renewal was due in July in 2019, that's when it will be due again, so that it reduced system changes, because we know that's all pretty, that can go, who knows how that will go. And honestly, we felt like it would reduce confusion for participants if their renewal date didn't change. And then some of the big technology and system pieces that we did, we have secured some advanced artificial intelligence, including reading documents that are submitted, including the annual renewal and several other documents that we're going to really hit in that first phase. But it allows that document to be read by the artificial intelligence and populated into the system, instead of the worker taking the time to do the data entry, which goes back to what you said, Blake, about allowing the worker to do the work that they are passionate about and hired to do, is determining that eligibility and not spending the time just doing data entry. And then one of the biggest pieces of technology we feel like is going to make such a huge difference in our world and just really add capacity in general is Insights Engine. It's basically taking our electronic verification, bundling it together, presenting it to our eligibility staff to say, here is a red light, green light, kind of, here, this case is ready to go. You have everything you need. You can just process the case and move on. and here's one that may be a little more complicated and you may need to look into, there may be some verification missing, but it really makes it very clear for the staff what kind of is expected from that case when it's sitting right there in front of you. And it will allow lean into that electronic verification as much as possible, which CMS has really encouraged. And I'll be honest, Missouri didn't take advantage of it and lean into it as much as we should have prior to the pandemic. I think that really opened our eyes, the pandemic, on how beneficial that electronic verification is and how we should lean into it more. So those are the three big things that we really have done as far as technology and systems.
Thank you, Melissa. And I really like the fact that you're looking at the red light, green light, yellow or caution, because with so many new staff, it helps you to triage, where that work goes. So thank you for sharing. Jennifer, what are you seeing in terms of anything that you're seeing that sticks out to you in terms of innovative technology?
We're seeing a lot of great attention to the ex parte process, to the automated renewal process, and states really kind of examining what they have in their eligibility systems. Many of this was programmed before ACA implementation 10 years ago, when people didn't really kind of understand the full range of the flexibility that states have with regard to ex parte renewals. So some of them are simply removing blockers. They required consent to renew, or they required consent to access IRS information, and just kind of off-ramped a high percentage of cases if they didn't have that, or if they had SNAP as well as Medicaid or something like that. So in some cases, simple tweaks to the eligibility engine there can make a substantial difference to their ex parte rate. We've also seen states pay a little more attention to
Connecticut. Yeah, go ahead.
Right. We've also seen states pay a little more attention to their online renewal form and their online account access to make it a little more accessible. I think we sometimes had an attitude of, if we build it, they will come, or we checked a box and we have an online account. But states are looking more closely at how well it's being used and what are some of the access barriers, because obviously that's a great way for folks to renew and often makes it simpler on the back end for the state to process it as well. And overall, just maximizing use of data sources. In some cases, it's newer data sources like National Change of Address database for addresses, but it's also looking at how to truly integrate things like the asset verification system. That's got huge potential for the non-Magi, for the age blind and disabled population, to verify assets electronically. And that helps both that application to request fewer bank statements and documents from the client, but that really opens up the non-Magi population to these automated renewals. They often have very stable income that can be verified through Social Security Administration or other sources. And if these assets can be verified, if you can apply the right reasonable compatibility policy to assets, you can really take this vulnerable population and keep them connected to the program, keep eligible folks connected without having to fill out burdensome, confusing forms and send them back. So lots of good progress in that area.
Yeah, thank you, Jennifer. And I'm monitoring the Q&A, and you all are asking some fabulous questions. And I think we're going to have about 10 minutes for me to assign these out to the panelists here at the end. So never fear, we're watching them. Next slide, please. Next, we're going to get into data. As we know, there are reporting requirements that go along with the unwinding. And so let's start this one with Melissa. How are you planning to track and report on your progress, or what's going well with that, or what are you still working on?
Thank you, Blake. I'm going to be honest, we are probably going to struggle with pulling the data together. We have the data, but receiving it timely and putting it in the format and with the other data that's requested is going to be our big struggle. We have been working with our data group to, get that lined out. That's probably one of the biggest worries we have, is getting it timely and putting it together. I think we have a bunch of pieces of the data, and putting it together in the format and at the time we need it is going to be the biggest struggle for Missouri. So I don't have any great words of wisdom on that one.
Work in progress, right?
Yes, absolutely.
Yeah. Okay, so let's hear from Connecticut. Laurie, what are your all's plans?
So honestly, and I'm sure that many states would say the same thing, that data has become a strategic priority for us. So we actually invested in a business intelligence and analytics director about 2 years ago, brought them on board so that they could actually do a deep dive into our data, consider so that we could make data-driven decisions, right? We use that phrase all the time and it becomes somewhat cliche if you're not actually looking at data that you have confidence in and you believe that it's actually measuring what it purports to measure. So I can say that we have access to a lot of data. We've been using a lot of data, but our biggest fear was we have data coming from a lot of different sources, and the requirements from CMS requires that we provide some of that in the aggregate. And so trying to make sure that all of that data is synthesized in and is actually all coming together in the same way, that we're not comparing apples to oranges and throwing them all into the same basket, is one of our issues. So we've been doing a lot of diligent work, and Sharon Condel actually could speak much more eloquently to the systems work that's been done around this, but I can say that they've been working diligently to do dry runs repeatedly to make sure that the data is being culled appropriately. So we are cautiously optimistic, but Sharon, if you wanted to chime in and just speak to whether, how optimistic we are about that.
Please do, Sharon.
Well, I think this goes to one of the conversations we had. We don't know what we don't know, right? So we've been doing these dry runs over and over to try and see if the numbers make sense to us, and we're comfortable with them and how we're going to put them together. And I think we are comfortable, but these systems weren't intended to do what we've done to them over the last 3 years. And so while we're confident that we are going to be able to provide the data that's required of CMS, and for our own, our own information, so that we know what we're doing, it is a little bit scary because there is a big unknown out there. So, but I think key for us is really doing those dry runs, because you can get a report and look at the data and it just doesn't make any sense, and you have to really look at it and dig into it and understand what you're putting together. And I think too, because we have our health insurance exchange and our integrated eligibility system, we have to figure out a way to put that data together that makes sense for our federal partners, and so that they understand it and that it makes sense to us as well, right? So there's going to be a lot of due diligence working across our policy folks and our systems folks to make sure that what we're actually turning out is what we think it is. We're pretty confident, like I said,
Good.
but
Good. I once had a coach that said, it's not practice that makes perfect, it's perfect practice that makes perfect. And what he meant by that was it has to become instinctual. So I love the dry runs that you are doing, and so many states are out there doing. Jennifer, from the CBPP perspective, what advice are you all giving, or what are you seeing in terms of data?
We're just looking to try to kind of set some expectations. We know it's going to be messy, but we're really excited about these really important steps in the right direction of having truly human-centered design, human-centered metrics, not just were you timely or not, but looking at things like procedural denials that might feed into churn, looking at things like call center wait time that truly affect access. We know that there have been pieces of that done at the state level for a long time, but this is the first time that there's some degree of standardization and data reporting that needs to go up to the federal government and will be made public. It'll be made public nationwide, which I'm sure is terrifying. And I understand that is terrifying for us too. But it's a chance to see what is the appropriate rate of procedural denials. How do you rank against other states? What states are knocking it out of the park in this area, and what are they doing, and how can we kind of learn from that? But at the same time, it's going to be hard to interpret. There are people who will no longer be eligible for Medicaid. Many of them may not send back a renewal form. That's going to be a procedural denial. How do we separate those folks from the folks who definitely remain eligible, but didn't get the form, didn't understand it, or it wasn't processed at the state level? So we're going to have to kind of look at that carefully. But to the extent that we can figure it all out and rely on it, it's going to be essential for mid-course corrections. How can we be looking at that and figuring out where we're falling short? And again, taking best practices from other states, learning, having this learning community nationally to try to reduce these or fix up some of these metrics before the end of Unwinding and into the world beyond Unwinding, if we last that long.
All right. Thank you. Thank you so much. Next slide, please. Now, this one's kind of it's a big one, but I was fascinated in the dry run. But in terms of policy and budget, a couple questions to consider. How are agencies approaching the unwinding from a policy and budget perspective? And are there any long-term consequences you are either worried or excited about and things that you've been putting into place. So let's start with Sharon from Connecticut.
Yeah, so we made a decision that we were going to actually do an APD for the PHE Unwinding and seek 90-10 funding for some of our activities. We felt that it was really the best thing for us to do in our current situation, and it made a lot of sense for us to do an APD that focused strictly on the Medicaid changes that we needed to make and the Medicaid areas that we needed to support, and whether that was systems work or people or process, we kind of rolled it all into one. So that APD was key for us in doing that. We also used some of our funding, the ARPA funding throughout the years over the last 3 years to facilitate some of the work that we've done. Long-term consequences, I think there's, you know, again, it goes to the we don't know what we don't know, right? Did we don't want to do any harm, right? So we're trying to make every effort that we can to ensure that folks remain eligible, and we think we've done the right thing. But you know, we have people who haven't touched these documents and these systems in 3 years. They haven't used our front ends. They have never seen a renewal. We have staff that haven't done this work. So concern just for where we're at, and you know, we deal with people's lives every day. So that's really my concern. I know it's not policy or budget, but all of this essentially rolls back to the people that we serve.
Yep, and luckily you have a workforce that is intrinsically motivated that way. So it's a wonderful spot to be. Okay, Melissa, how about Missouri?
Thank you, Blake. We really leaned in on policy as far as every kind of flexibility that CMS would allow us to take. We really leaned into that to really expedite and do as many ex partes as possible during this unwind, but also just to streamline and really simplify the process for everyone involved. So we really leaned into the policy, the flexibilities in policy. As far as a budget perspective, a lot of our COVID relief money we used to gain valuable technology that not only helps the state, but also is very customer friendly and customer centric on a portal where they can do find a lot of the information that they need or complete the annual renewal. That will be coming up in the very near future. Again, I talked about some advanced artificial intelligence and the insights engine. Those are all very customer centric to make it better for the participant and the customer, but also really adds capacity when it comes to staff processing cases. So that's where we've really focused when it comes to policy and budget. What are the long-term consequences and what am I worried? So I'm both worried and excited about the technology because, of course, you know, I have a vision of how I think it's going to happen and when it's going to happen. So meeting that kind of has me worried in the background, making sure that technology occurs when it should and functions exactly like the vision I have in my head. But also, I'm very excited to see that because I really think it will totally transform how Missouri does work and how we serve our customers when we can get it in the right spot.
Okay, thank you, Melissa. Jennifer, how about from the CBPP perspective?
Well, we've seen some concerning pressures from legislators to really go faster during unwinding, to get ineligible people off as quickly as possible. And as you all know, this is a hard enough task over 12 months. And when the legislature kind of meddles and forces things to go faster, that can be problematic and lead to inefficient service and eligible people losing coverage. We're hoping that the enhanced FMAP that is extended through the end of the calendar year will help relieve a little bit of that pressure in states, but something we're watching really closely. Long term, we have a little bit of a concern about backlash against the program, that the fact that people are losing coverage could be construed as waste, fraud, and abuse, even though the legislation Congress passed said that they have been eligible this entire time. I'm worried about how the program might be viewed as things might get a little bit rough over the next year. So trying to kind of prepare for that and make clear that this is a good program and necessary. But what we're really excited about in the long term is how states are doing these innovative things, like you heard from these two awesome states here today,
Absolutely.
had flexibilities during the pandemic on policies and operations and where there are good places for that to continue long-term. And looking at specific things like E14 waivers that are allowable during the pandemic, where are those really key things that could transform things going forward? And how do we find a way to take these natural experiments that happened during the pandemic and make them part of kind of regular life going forward and benefit from them in an ongoing way?
Okay, thank you. So now I want to switch to Q&A. Thank you, panelists, for all of this. And so I'm going to popcorn some of these questions. And for those of you listening in, if it's not answered on here, we will definitely answer it in the follow-up. Look for the follow-up email with the slides. Sometime either Tuesday or Wednesday next week. It'll come from Change and Innovation Agency, I believe. And if you don't get it by then, please look in your spam folders and we'll ask APHSA as well. But first one had to do with the text messages. And the question was, what type or are there specifics being sent in text messages? Anyone?
So for Missouri, we are very careful on what we say in text messages. We keep it very generic and say stuff similar, don't quote me on these wordings, but the Family Support Division kind of needs to talk to you, please call us or email or whatever the case may be. We try to keep it very generic, but do put some urgency that we need to have some contact.
Okay. Connecticut?
We are, yeah. Hi, this is Laurie Ann. Our text messaging right now is really, we just started a pilot phase of this, and it was very specific around the SNAP on the emergency allotments. And we are going to be expanding it to beyond that, but they're generic. They're about your renewals are coming due. Keep an eye out for notices that will be coming in. We have not been doing any targeted to specific clients, so client specific noticing in the text messaging. That's something we will be exploring, but the text messaging has been used for more of those broadcast messages.
Okay, thank you. So the next two questions, I believe, are for Connecticut because it talks about the training. So the first one, and I'll say them both, how long is the second round of training after the first 2 weeks of training? So when you send them out to the field and then bring them back, Yecenia. And then the next one is what other programs for the Agile workforce are they being trained in?
Sure. So our new staff members, they go for a 2-week training on basics of eligibility, how to search for basic questions a client may have, how to send certain forms, so on and so forth. Then when they get back, they do this first touch part for a couple weeks, and then they go back to training, which is what we call core. That is approximately, could be anywhere about to 10 weeks or so, in which they learn all our programs, which are Magi, non-Magi, SNAP, and some of our cash programs. So that's why we call them an agile workforce now, because in the past, what we used to do was we had 3 basic functions in our agency. We had 3 offices assigned to benefit centers. 9 offices were assigned for processing only. And then all 12 offices were what we call service centers. Our processing offices had specific assignments to specific programs. So you may have one office was assigned strictly to just do medical. Another one might be doing SNAP only. So we made the decision that that wasn't working for us with the decline in our staff. And we wanted to make everyone agile so that we had the ability to move our staff around depending on what the need was at any given point in time. And we can just be flexible. And the staff also, it allows them to build their knowledge and expertise.
Absolutely. Thank you.
You're welcome.
The next question was for both Connecticut and Missouri. And the question was, do you both have integrated eligibility systems?
So for Missouri, we have our Magi in one system, and then we have non-Magi, SNAP, and TANF and childcare in another system. We are eventually working to move all of our programs into the same system that currently holds Magi. We just have not made that full transition yet.
Okay, Sharon.
Yeah, essentially the same setup. We have our Magi groups in our health insurance exchange, and then we have our stat cash, non-Magi Medicaid and long-term care and home care in our integrated eligibility system.
Okay, thank you. The next question is, it would have been nice to hear from states where eligibility determinations are being done by county workers, not state employees. Challenges are very different. And if you're okay, when we follow up, we can certainly send you some information on things that we're seeing, and maybe Jennifer can talk to this too in county administered states. But Jennifer, anything on that one?
Definitely hear the different set of challenges that are happening in a county administered state. Sometimes it's challenging when the policymakers at the state level are a little bit more separated from what's happening on the ground in the field at the county level. But it's also an opportunity for innovation and sharing. We've seen counties that have developed really innovative ways of approaching things, innovative task management systems and other technology that they can kind of try out in their community. And then if it's successful, spread statewide. So definitely different sets of challenges and opportunities in that setting.
Right. And Barbara, who asked that question, we work in several county administered states that we can certainly, when we follow up, send you information and contacts for those people. Next question is, how do you incorporate language access services into your processes and workflow management? Anyone?
So
We have
I'll give you
about 5 more minutes, just time check.
Okay.
So.
Real quick, I'll say Missouri offers our forms in a couple of different languages, not just English, so that's one way. We also have, we utilize what's called Language Link, and offers translation services in a wide variety of different languages.
Okay. Connecticut, anything or CBPP? Okay, well, and we'll find some stuff there for you as well, because the next question was, there are 240 different languages throughout Los Angeles County. And so we can certainly tell you some of what we've seen out there when we
Yeah, so I'm sorry, I can jump in. I think that any specifics on how it works and the challenges that staff may encounter, but we use something very similar to Language Link. I think ours is now Language Line, but it's something similar, and it's a service where telephonically you can call out, you get the interpreter on the phone, and then you do a 3-way conversation with somebody, and you do that whether they're in the office or whether you're talking to them on the phone. And that works. There's thousands of different languages that we can use. We also do have a large Spanish-speaking population in the state of Connecticut. So we have many Spanish-speaking workers, though I do not believe we have an adequate amount to staffed, dispersed across the state in such a way that we can always have a Spanish-speaking staff member speak to a Spanish-speaking client in real time. And that's why we do rely on that additional service.
I would just add that states struggle with this. It's really difficult, but it's essential. So encourage, when we talk about data, to look at both the numerical data as far as how are things differing across race and ethnicity, and how are different language groups possibly struggling greater than others, but also the kind of softer data. What are you hearing from on the ground about individual struggles among different communities? Because this will be more challenging for some than others, and we need to monitor that very closely and act where possible to fix those issues.
Okay, I only have time for one last question and then a wrap up, but if we could hit the next couple of slides. But Connecticut and Missouri, do you have employee caseloads or transaction-based processing, or a hybrid?
This is, for Missouri, we do not have caseworker caseloads. So it is more of task oriented, and I maybe work on SNAP one time and then turn around and work on Magi the next. So very high overview of how we handle it.
For Connecticut, similar. We do not have caseloads.
Okay.
It's task-based.
Okay, thank you. For the rest of you, when we follow up, we will answer the questions here, because I see some really good ones in here, and we will make sure that their answers sent out to the participant list. What I will also say is, please go to the last slide. What I also say is, in what we follow up, you will have each of the participants here Before you go, if you wouldn't mind putting anything that you found interesting today in the chat, any other questions you want us to answer amongst ourselves and the panelists, when we follow up, we certainly will. But I do appreciate you all. I want to say thank you to the panelists for everything that they've done and prepared, and really being in the trenches and sharing some of that with the group today. For all of you about to face this come April 1st, I wish you nothing but the best of luck. And I know that the way that most of your folks are charged is to help others. And so, while this is going to be a heavy lift for everybody, I have no doubt that you'll have a workforce that is fully charged to help others. So if there's anything remaining, please say so. Otherwise, I would just thank you and wish you a great day.